Local milk banks, they are seeing a huge surge in interest, both from parents looking for an alternative to formula and nursing mothers looking to donate their own supply.
Yeah, so joining us live this morning is Linda Herrlich, the executive director of the New York Milk Bank. Linda, thanks so much for joining us this morning.
Oh, good morning. Thank you so much for having me.
So talk to us first about the work that the New York Milk Bank does and the areas that you serve.
Sure. Well, first and foremost, our primary objective is to focus on premature babies, providing milk for premature babies in the hospital when their mother's own milk supply is either insufficient or unavailable. For premature babies, human milk is basically a medicine. It is a medical necessity, and it really does help prevent long-term health complications.
So in this case of what's happening right now, what are you seeing in terms of demand from parents that are looking for donated breast milk to feed their child? And are you helping them if their child is not a premature child?
Well, we do. Well, first I just want to say that we've had enormous interest from moms who have excess milk who want to donate their milk. So, for example, we used to, in the past couple of days, we've gotten like at least 20 inquiries, sending out 20 applications for donors who want to donate their excess milk, when in the past it might be, one or two a day. So that has been incredibly inspiring. Moms are coming together in lots of different ways to help other moms who are in need.
Yeah.
We do have ample supply for our hospitals, which we serve all of New York and into northern New Jersey and even a little bit into Connecticut. So we have ample supply for our hospitals as well as for outpatients, moms that are looking for human milk. But I will say there is a cost. And so it's not affordable for everybody.
Right.
We do try to work with folks, alleviate the financial barriers, but we do have the supply.
Yeah. So, but who is eligible to receive the donated breast milk? Is it anybody?
In New York State, you do need a prescription for us to be able to dispense the milk. So you have to talk to your healthcare provider. And then following that, it is available. It is covered by, we work with insurance companies for outpatients. The coverage is not broad, and that's something that long-term we really want to work with and advocate for.
Yeah, and the demand right now is across the region, from same-sex couples who really, obviously they can't produce their own milk in certain cases, and so they're looking for those donations. So how does a mother who wants to donate her breast milk go through the process to contact you and become a donor?
Yeah, great question. Contact us first through nymilkbank.org. You'll fill out a very short survey. We will then reach out to you. Please be patient with us because we have had, increased demand for information about donations. We'll contact you. There'll be an over-the-phone interview, an application that's filled out. A medical provider provides clearance, and then there is a blood test. And then following that, the milk can be donated.
Yeah, and I think that's a concern that maybe not all parents in need know about, whether or not, especially during the pandemic, that all of this milk is tested.
Yeah.
Right?
Oh, yes, absolutely. Not only is the milk, the moms, we ensure that the milk is safe when it gets to us. It's then kept in our freezers until it is ready to be thawed and bottled. It is then pasteurized to eliminate any pathogens. And then a sample is taken and sent to a lab to ensure that the pathogens, if there were any existing, were indeed eliminated. So our milk is pasteurized. It's safe for premature babies and full-term babies.
And Linda, for some folks, from parents who may have only been using formula, right? And I think there's a common misconception that they have to stick with that same formula and not introduce something new. Can you clear that up?
Yeah, absolutely. I am not a clinician, so
Yeah.
I always suggest that moms, parents have to check with their healthcare provider if they're going to make any changes. But changing from formula to donor milk should not be an issue.
All right, and just real quickly, if you can repeat how people can reach out to you and donate, or to find out how they can receive donations.
Absolutely. nymilkbank.org. Please reach out to us, and we will be as much assistance as we can.
All right. Linda Herrlich, thank you so much, Executive Director of the
Thank you.
New York Milk Bank. Thanks for what you're doing. A lot of parents out there in need.
Yeah.
Thanks for covering the story. We really appreciate it.